My name is Jane Camisa. I've been a nurse here since 1987, so what is that, 26 years? I work on the transplant vascular unit. I like helping people. I like making a difference. Anybody can do the technical part of it, but when you treat the patient as a whole, it's a wonderful experience when you make a difference in their lives. Most of the success for any kind of transplant, any kind of patient, is what the nurses do at the bedside. And if you don't have good staffing, you don't have adequately trained nurses, and you don't have nurses that really care, then you're not going to have that outcome.
Westchester Medical Center, we do have a lot of pride up here because we're unique to the Hudson Valley.
We don't turn anyone away.
We are willing to take on a lot of tough cases.
We have probably one of the highest case mixes in the country. So that basically means that we have some of the sickest patients in the country. The only level 1 trauma center in the Hudson Valley. The only burn unit from Manhattan to Canada. We do it all here.
We take care of 7 counties here. We take care of patients that other people don't want to take care of.
The staff here works very hard to keep the level of care as high as it is.
We are under attack. The hospital laid off over 140 nurses back in 2011.
It was mass chaos. It was just absolute chaos. They would take one nurse and put her in another area, and this nurse into another area, and making some nurses go from full-time to part-time or to per diem.
They laid off 140 nurses, seasoned nurses. They displaced nurses of 15 years into other units.
And we're really down to the bare minimum. It is really short-staffed, and quite often we are made to work with just one nurse on a unit. There have been several near misses. We have had nurses that are now injured and out of behavioral health because of the injuries they sustained due to lack of staffing.
They tried to backfill us with agency nurses. Agency nurses can't do what we do.
We have an open heart unit, we have a SICU, we have a MICU, we have a TICU, we have a neuro ICU. And the nurses from those areas are so highly trained and developed. You can't just put any nurse in there.
A nurse is not just a nurse, just like an attorney or a doctor. I'm worried about what my nurses are going through, what I'm going through on my units. I need to provide the best care to my patients because they deserve it.
In July 2012, the hospital laid off our clerks and our aides.
The nursing assistants have worked here for years. They know how to take care of the patients. They know how to do the work, and they did it very well.
In our burn unit, the aides we have are specialized aides. They're actually called burn techs. They've been trained over the years by not just the doctors, but the nurses also, to do very specific burn dressing cares. And without them, think about a patient who's burnt. They have severe pain constantly. And the longer it takes you to do a dressing or any procedure, you're putting them in prolonged distress. Now they basically have just outsourced everything to an agency. If it takes a nurse before to do a burn care, say within half an hour, it may take 45 minutes now without the specialized burn tech.
The nursing assistants were outsourced to a company, I think it's called OWS.
The supervisors from OWS call themselves nursing supervisors. Some of them are LPNs. They're not registered nurses. And they direct or give directives to not just the OWS staff, but as well as our own staff. It causes confusion. The so-called nursing supervisors from OWS don't know what's going on in the entire hospital. They don't have the big picture. They don't have the right to do that. They're not even RNs, and they're not Westchester Medical staff, but they call themselves nursing supervisors.
Hospitals are only here to do one thing. We're only here for the sick.
The focus is now on profit. Our CEO and the top administrators here, including our chief nursing officer, make outrageous salaries.
It's kind of a slap in the face.
Every employer wants McDonald's employee prices for professionalism. Things that you can't just put a label on, you can't put a price tag on, they do. It comes down to the bottom line. They find ways to buy things, toys for themselves, give themselves bonuses.
They care about those HCAP scores, and they're giving us scripts to say to patients. That's fake, it's phony.
I also miss spending time with patients and their families during visiting hours. We just don't have that kind of time anymore to be able to do that.
we've over the past year, we've won back about 50 RN positions. It's been a hard-fought battle.
We also have, through NYSNA, what's called a POA, protest of assignment, and many of us are very adamant about filling those out.
It basically, you can't refuse an assignment. So what a nurse would have to say is, I'm going to take this assignment, even though it seems crazily busy and dangerous, but I have to report this somewhere to my supervisor, and so that I'm able to practice and do the best job I can to make sure the patients are okay, but I'm notifying you that it's not a safe situation.
Sometimes the manager goes, do you really think you're unsafe? I've been in that situation myself. It's my professional opinion. This is not the care that I would give in optimal conditions.
We've had nurses fill out their process of assignments like clockwork, and we've had over 4,000 POAs.
We have sent these protests of assignments to the Board of Directors. We have sent them to the Department of Health. We have sent them to the Department of Mental Health. We have contacted our local legislators. I myself went up in front of the Senate in Albany to make them aware.
And I think that has prompted management to wake up and go, we have a problem here. We've been NYSNA for a long time, and we've held the NYSNA banner here for a long time, and we've been able to make a lot of changes professionally here because of NYSNA.
We are at impasse. We're asking you not to work here. This is an invisible picket line.
We take care of the sickest. You cannot just bring an agency nurse with unknown credentials to pop in. We're not interchangeable.
This is a message to my fellow RNs.
The nurses at Westchester Medical Center are making a stand to defend safe patient care.
I'm asking you to please, in solidarity,
Don't work agency at Westchester Medical Center.
I beg of you, I implore you, please don't cross our picket line.
What is happening to us at Westchester Medical Center could happen to you tomorrow.
Please do not come to Westchester Medical Center and work as an agency nurse.